Hello, everyone. I'm so honored to be here this afternoon to speak with you, and I've been so inspired by all of the lecturers today, especially the survivors panel. And what impressed me the most is that concept of hope, and I was trying to think in the context of nutrition and what I was going to talk about today. And I think what we can take from nutrition and hope is that nutrition is another source of empowerment for us. So when there's so much that's out of our control, obviously we don't know what lies ahead in the future for any of us. But one thing that we can control is what we eat, right? We all say we are what we eat. And that's why I love what I do so much, because I can inspire people in that fact every day. So I hope I can offer you some good information today, and I look forward to your questions during our panel later. So being an oncology dietitian for over 10 years, what are some of the common questions and concerns that patients often ask me? Well, first off, I know many patients and survivors often struggle with weight management and a lot of nutritional issues that can occur before, during, and after treatment as well, and in fact can linger for many years beyond treatment. Often, patients are quite confused with the wealth of health information out there. What is the best diet? How do I lose weight or manage my weight? Do I need dietary supplements? And what about exercise? Not to mention all of the information you can find with a quick Google search and the amount of websites that can pull up when you type in nutrition and cancer or ovarian cancer and nutrition. So what are some important questions to ask? Is there a magic bullet or miracle food? And what can we do to help promote our overall health and reduce our risk of recurrence? I usually start with the American Institute for Cancer Research guidelines, and I think it's a really practical and common sense place to start when it comes to nutrition, wellness, and a healthy lifestyle. Be as lean as possible without becoming underweight. Of course, we've talked multiple times today about the importance of physical activity and exercise. Avoiding sugary drinks, basically empty calories, limiting our consumption of energy-dense foods that don't give our body any added nutrition. And of course, this is my favorite, eating more variety of fruits, vegetables, grains, and plant foods. Limiting our consumption of red meats and processed meats. And if consumed at all, limit alcoholic drinks to 1 per day. And we'll go into these in more detail. Limiting consumption of salty foods, basically processed foods, things that are full of sodium and preservatives. And very importantly, I know a couple of people addressed on this as well. Don't use supplements to protect against cancer. Ultimately, it's a healthy foundation with diet. That's the best place to start. So when we talk about alcohol, the current research shows that women who drink 1 alcoholic beverage per day or more may have a small increase in risk. So it's important, especially if we're considering a hormonal sensitive cancer. So what counts as a serving? Well, it could be 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. It actually reduces to 1 ounce if it's over 100 proof. If you are someone who includes alcohol in moderation or here and there once in a while or at a social event, one thing to keep in mind is that it is important to include folate-rich foods in your diet because alcohol can interfere with the metabolism of folate. So it's important to make sure you have good sources. Bananas, oranges, and tomatoes are some of the obvious ones, but also you've got your dark leafy greens, legumes and lentils, fortified cereals. A lot of our common breakfast cereals are fortified with the fortification or supplement form, which is folic acid. And of course, many supplements, multivitamins, or even just specific folic acid supplements can be used under the guidance of the physician and medical team if need be. So one of the other common themes that was in those initial guidelines that we just talked about is the importance of a healthy weight. And a lot of times people ask me, well, how do I know? What is a healthy weight? How can I put that into perspective for me? Well, there's some common rules of thumb that we can use. First off, there's something known as your ideal body weight. So for a woman, that starts at 100 pounds at 5 feet tall. After that fact, you add 5 pounds for every inch over 5 foot. Now, there is a range, so this is not an exact science. You can add 10% if you have a slightly larger frame, and you could subtract 10% if you're of a smaller frame. Even still, that's not the only number that we would use to predict your weight status. I'm sure you've all heard of the BMI, or your body mass index, or seen that fancy chart on the wall in your doctor's office that you can kind of link your height and your weight and check your BMI. An easy calculation is to roughly take your weight in pounds and multiply it by 700 and divide it by your height in inches squared. You can also Google BMI calculator online and easily calculate it online as well. So how do you define your BMI? 19 to 25 is considered a healthy weight. Over 25 we consider overweight, and over 30 we consider obese. Once again, all numbers, not an exact science. So another thing that we use from a nutrition standpoint is we think about your body shape. Obviously, this in some ways is more of the genetics. What is your body type? Well, there are certain people who are more of an apple shape. This is when a larger distribution of your body fat is in your abdominal area. And then there's certain people who tend to store fat more in their hip, thigh, and buttock area, which is known as a pear shape. So we do know that people who store more fat in their abdominal area may be at higher risks of chronic disease, simply because the abdominal fat is much closer to your visceral organs, is not as healthy in that particular area of the body. So how does this relate to cancer? Well, the theory is that hormones are stored in our body fat. So if you have a greater percentage of body fat, potentially a higher level of storage of hormones such as estrogen. This potentially can increase the risk of a hormonal cancer. So what does this all mean? Well, we don't necessarily like to get people too caught up in numbers and statistics. First off, the formulas don't take into account the amount of lean body mass that you have. So if you're somebody that exercises a lot and may have a little bit more muscle mass, potentially your BMI is going to be slightly higher. So they shouldn't be used as a sole predictor of your health status. What it is it's a guide. Where you are and maybe where you need to be to help you set some good health goals. So now that we've put into perspective the importance of a healthy weight and kind of how we can see where we are and make some goals for ourselves, if you're somebody who wants to achieve a healthy weight, where do you begin? So some good rule of thumb that I like to use in terms of making some healthy changes to your diet are simple things. I like to make things simple and practical for people. First off, one thought is that we want to try to include more dietary fiber. Dietary fiber is going to help us feel fuller, is going to help control our appetite if you're somebody who has more of a tendency to feel hungry all of the time, not to mention the numerous benefits in terms of digestion and cancer prevention. Now, I do know that a chronic issue potentially for some ovarian cancer survivors may in fact be partial obstructions or reasons why you may not be able to get to the full goal of dietary fiber, and that's okay. I encourage you to perhaps meet with a dietitian and talk to your healthcare provider about the right goal and the right goal of dietary fiber for you. So when we talk about dietary fiber, the ideal goal is between 25 or 35 grams per day. But like I said, it could be more individual for you as a survivor. If you can try to choose more whole grains and complex carbohydrates, that's a great place to start. Even just avoiding the simple carbohydrates and simple sugars, those empty calories I mentioned earlier, is a really important change in your diet and your overall health. And then lower fat. How can we do this and why is that important? Well, we're going to go through this in a moment as well. Choosing leaner proteins, avoiding the unnecessary added fats. Believe it or not, fat has more than 2 times the calories as protein and carbohydrates, so it adds a lot of unnecessary calories when used in large amounts. Choosing more low-fat dairy products, being mindful of the hidden sources, and we're also going to go through how to look for more healthier fats. So the sources of complex carbohydrates come from our grains, including things like bulgur, brown rice, whole wheat pastas, millet. Maybe think outside of the box and try to incorporate something that you're not, maybe not a staple in your diet. Things like couscous or quinoa, things that you may have never really considered as an option would be a great way to add a new grain. Cereals, once again, things, just if it's darker, like if you pick up a box of bran flakes, doesn't necessarily always mean it's going to be a high fiber cereal. So it is important to look at the food label and make sure that the food label does indicate that it has at least 5 grams of dietary fiber per serving, because that's a great way to make sure that the cereal you're choosing is a good source of fiber. And then breads as well. Once again, same concept. If it's a brown bread, it doesn't necessarily mean it's going to be a high fiber bread. Make sure to read the food label, at least 3 grams of dietary fiber per serving, and try to look for things that have one of the first ingredients as 100% whole wheat or multigrain, rye, pumpernickel, something like that. You want to make sure that that ingredient list and the food label match the fact that it's a good high fiber bread product. Legumes and nuts are also great sources of fiber. Nuts especially can be a little bit higher in calories because they are good sources of healthy fat. So just make sure you're sticking to a good portion, which is about an ounce or two think of the size of your palm. That's a good portion of nuts. And beans as well. You want to include lentils, beans, maybe different forms that you haven't really been accustomed to. Try a minestrone or a bean salad now that it's summertime. Obviously, beans can potentially be more gassy, and I know that can sometimes be a lingering side effect after treatment, so you can always consider an over-the-counter supplement like Beano, which contains an enzyme that actually helps your body to digest that carbohydrate and that fiber that can cause the gas in some of these foods. Or just use them in moderation. So when we were talking about lower fat intake, and I mentioned some of the key components earlier, here's a little bit more on the specifics of how to choose lean proteins. First off, we want to look at our dairy products, and if and when at all possible, to try to choose non-fat and skim, or low-fat and non-fat cheeses and yogurts as well. Remember, these dairy products, when they come in their full fat form, are going to contain saturated fat. That's the kind of fat that clogs our arteries and predisposes us to high cholesterol and heart disease. So it's very important to try to be aware of the fat sources in your dairy products. And meat as well. We want to try to choose white meat chicken and turkey, lean pork. Believe it or not, the dark meat of a chicken actually has 2 to 3 times more fat than the breast meat. So just by making that healthy change, you can make a big difference. And another great goal, and especially now that it's summertime, it's really important to try to think of including, fun and fresh meals now that we like to enjoy barbecuing and being outdoors and things like that. So consuming fish a little bit more often is another great goal. And often I encourage my patients to try for 2 to 3 times per week. If you're not somebody that's used to eating fish, you can definitely start slower than that, but that's a decent goal to aim for. Limiting red meat is another goal that I often encourage. Less than twice per week, even if you can get that to once per week or less, is a good goal. And that's all in the context of kind of where you are and where you're starting from. So as I mentioned earlier, in the context of lower fat, one thing we don't want to forget is choosing healthy fats. So even though we're looking at reducing our overall fat intake and avoiding the unhealthy fats in dairy products and fuller fat meats, we still don't want to lower our fat intake too much where we're avoiding the healthy fats. So first off, we want to be aware to eat more omega-3 fat. Omega-3 fat is a polyunsaturated fatty acid that actually has very, very important anti-inflammatory properties in our body. Most people actually don't eat a lot of omega-3 in their diet. And omega-6, which is another polyunsaturated fatty acid, the common ratio in the American diet is about 14 omega-6 to about 1 omega-3. And ideally, we really want that ratio to be closer to 4 to 1 if possible. So as you can see, we're kind of far off. And that's because not a lot of people consume fish, nuts, seeds, these sources, canola, flax. They don't necessarily consume these sources as regularly as they should. Even if you're someone who feels that you want to include more omega-3 in your diet, and perhaps you have an allergy to nuts or fish or some of the good sources, you can potentially discuss with your physician and oncologist whether or not supplementation with fish oil might make sense for you. It is important to discuss it with your medical team and also your nutritionist and dietitian, because there are certain forms that are more beneficial than others. And it is also to make sure that it doesn't interact with any other medications or treatments that you may be on. So the polyunsaturated fats, the omega-3 and the omega-6, there's also a type of fat called monounsaturated fat. This type of fat is also very healthy and is actually linked to heart disease. We all know that olive oil is healthy, and the reason for that is because it's very high in monounsaturated fat. You can also find the monos in avocados, canola oil as well, nuts, especially things like almonds are very high in monounsaturated fat, and various seeds as well. Lots of the plant foods are coming through strongly here, as you can see. And then the omega-6 that I mentioned earlier, that other polyunsaturated fat, the reason why we don't want that ratio to be as high as I mentioned is because omega-6 potentially is more of an inflammatory fat in certain scenarios. It comes in a lot of processed foods like crackers, cookies, chips, baked goods, things that we don't really, we all know that we shouldn't really have a lot of these foods to begin with. So ideally, if you're trying to kind of skew the balance and make it a little bit more toward the omega-3, it's not so hard if you try to avoid a little bit more of the processed foods in your diet. And then eating less saturated fat, as I mentioned earlier, this is the type of fat that's not very healthy for our hearts. Fast foods, the full-fat dairy, like I mentioned, the skin of poultry, lots of red meats, and tropical oils are full of saturated fat. Interestingly, which I don't have on this slide, the trans fats, which are hydrogenated fats, basically trans fat is when they make a liquid oil solid. So it's what margarine used to contain before they were able to remove the trans fat. Now you'll see on every label trans fat free because it's become such a health concern, but believe it or not, they're replacing that fat with tropical oils like palm oil, which have saturated fat. So it kind of comes down to it's a processed food and it's going to have some type of unhealthy fat, whether it's trans fat or saturated fat. Always be mindful and read your food labels because you'd be surprised what's actually in the foods. So now that I've mentioned some kind of good tips in terms of what to look at and things to maybe work on changing in your diet, I definitely don't want to play down the importance of physical activity as well, because certainly nutrition and physical activity go hand in hand. So why is physical activity so important? Well, first off, obviously, we know it helps to control our weight. We're expending energy. Resistance exercise helps to build our muscle mass and can also help to build our metabolism. And as was mentioned earlier as well, physical activity and exercise are so important to strengthen our immune system as well. It helps promote regularity and improve our digestion, and can also potentially decrease our hormone levels. Believe it or not, active people can have approximately a 20% risk reduction of ovarian cancers. Physical activity is so important, and I encourage you to try to fit in small amounts if you can. And in a moment, I'm going to give you some kind of easy and fun ways to fit in more physical activity. The American Cancer Society actually recommends at least 150 minutes of moderate physical activity, or 75 minutes of vigorous physical activity spread throughout the week. So it sounds like a lot, but remember that's spread throughout the week. Even 10 separate bouts of exercise can be equivalent to 30 minutes all at once. So any little bit that you can fit in would be helpful. So here's some of the easy tips that I mentioned I was going to suggest. Things like parking farther in the parking lot, take a quick walk around the block during lunch. Hopefully, now that we've gotten all this rain out of the way, we'll have some nicer weather for the springtime for the next few months. Get up and walk during a television commercial. Even as somebody suggested earlier, kind of walking around the house or taking a walk up and down the stairs, whatever's right for you. And obviously, you don't want to start something new or a new exercise or physical activity regimen without making sure that your physician and medical team feel that it's safe and acceptable for you to begin something like that. Lifting Kansas weights. There's so many easy things you can do to just get more active. It doesn't always have to be in a gym or in a formal setting. One of my colleagues is a dietitian here at a cancer center in Manhattan and suggested this great website to present to you guys today as well. There's a great site called, an organization called BeFit NYC. where you can have access to free and low-cost fitness activities. So I encourage you all to check out this if you're looking for a way to kind of have, let's say, a group setting or something to motivate you a little bit more to get a little bit more active. And you all have this in your handouts, so you can check out this website when you have some time. Now, another important item that was mentioned earlier in the American Institute for Cancer Research guidelines was the benefit of fruits and vegetables. This is perhaps one of my favorite topics to talk about, and I could probably go on and on about it forever if I had to, but there's a nice analogy that I like to use when it comes to plant foods and our fruits and vegetables. If you think of your body as a nice, clean, tailored white shirt, and you got a stain on your shirt, you would want to promptly remove that stain and take care of it so that you keep your shirt nice and clean. Essentially, we can think of our bodies the same way. If we had a stain, essentially a damage to one of our cells, we would want to cleanse our body as quickly as possible as well. And our body's detergent, or way of doing this, is through the antioxidants and phytochemicals in our fruits and vegetables and plant foods. So phytochemicals are the plant nutrients that are naturally found in our fruits and vegetables. They help destroy carcinogens before they can damage our healthy cells. And the antioxidants, also naturally found in our fruits and vegetables, can help protect the body from free radicals. Basically, these are the byproducts of even natural metabolic processes in our bodies that have shown to play a role in cancer, and these antioxidants help to neutralize those free radicals. They help our body to repair and heal and keep our immune system strong. This slide is not meant to be confusing in any way. I just like to include it because it shows you how important these bioactive food compounds are in so many different processes in our body and why they're so crucial. So oftentimes, my patients ask me, well, which are the best to choose? And my answer is usually all of them, because you want to get variety. All fruits and vegetables contain potential cancer-fighting phytonutrients. You want to eat a variety of different colors. I usually like to say, kind of eating the rainbow to ensure that you're including the full spectrum of phytonutrients and antioxidants that your body needs. A goal for cancer prevention that we usually use is 8 to 10 servings per day, and it sounds like a lot, but it's something that you can aim toward and that you can start small. And remember that a serving isn't as much as you think it'd be. A modest-sized small apple is 1 serving. So a large apple is actually 2 servings. So it's not that hard to achieve more when it comes to fruits and vegetables. Even if you're someone who's still managing with, let's say, a partial bowel obstruction or limitations on some of your produce and your fiber, you can even choose an easier to digest form, like a canned form that's in a natural juice, or well-cooked vegetables that are tender to cut with a fork are usually easy to digest. You don't have to avoid them totally, and under the supervision and guidance of your dietitian and medical team, there's still ways that you can include these great healthy foods. So that last bullet under the American Institute for Cancer Research's guidelines mentioned don't use supplements to protect against cancer. But believe me, I understand how tempting it is, especially when you have a family member or friend show you, oh my gosh, look what I found on the internet. There's this great new supplement. You can take this and this is going to cure your cancer. And at certain times that's really, really enticing and very tempting. But what I want to try to give you is some guidelines on how to make an educated decision when it comes to evaluating these diet trends and supplements. And I'm going to use a specific example that people come to me with, and that's soy. How is soy related to cancer, and why do people commonly ask me about this? Well, soy, as we know, is a very high-quality plant protein. The isoflavones in the soy actually have potential phytoestrogenic properties, which means the plant chemical in the soy can actually mimic human estrogen, but it's a much, 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 much weaker version than human estrogen. So in fact, soy can potentially lower risk for breast, prostate, and endometrial cancers, hormonal cancers, obviously associated with hormones. But because of that property of soy, For a very long time, a lot of people were very nervous to include soy in their diet, or nervous to even consider soy, because they were concerned soy could potentially add more hormones to the body's environment and increase risk of cancer. But in the past few years, we've actually had a lot more research that's made it clearer to us that in moderate amounts, which is about 1 to 2 servings a day, and I'll go through what a serving is in a moment, that soy intake from a whole soy food is safe. We're going to go through what a whole soy food is and servings in a moment. So it kind of puts into context that something that in some ways can come out as a controversy, with more research and more understanding and proper discussion with your medical team, you can make the right decision, make that educated decision. So these are some things I usually encourage my patients to discuss with their physician and registered dietitian. Know your stage of cancer, your family history, what's your diet and prior soy intake. If you're somebody who's never ever consumed soy before and you have a healthy diet, it's not necessarily something you have to add right off the bat. What are your general diet and exercise habits, your weight history, your menopausal status? There's lots of factors that we consider when we discuss the role of soy in the diet. And what is a serving? So how do we know, okay, what counts as moderate? Well, one thing I want to stress, and you see that word whole in capital, we want to choose natural soy foods. You don't need to add any kind of soy supplement or soy powder or large amounts of processed soy foods like burgers, nuggets, chips, crackers, things like that, because that's the kind where we probably don't really need those foods, and potentially they have amounts that are in quantities that are not whole. They're not the whole food, and they're in quantities that may actually be too much. So you want to stick with the whole natural food, because that's the way nature intended us to eat those foods, and that's the way nature intended us to consume them and reap the benefit. So that would include half a cup of soybeans, 1/4 cup of roasted soybeans, a cup of soy milk, a cup of soy yogurt, an ounce of soy cheese, 1/4 cup of soy flour, or half a cup of tempeh. So there's lots of other foods, obviously, that I get asked about other than soy, and I'm sure some of you might mention them when we do our Q&A today. But like I said, the goal in trying to give you that example was to help you understand the importance of making that educated decision. So what did we consider when we kind of put everything together that I've mentioned today, our guidelines for optimal nutrition? How can we make smart goals and take steps forwards toward overall health and good nutrition for survivorship? Just to review some of the concepts we already discussed today: limiting our alcohol consumption, maintaining a healthy weight, choosing more whole grains, beans, and legumes to increase our fiber intake as best we can, increase our intake of nuts, seeds, and fish, all those great sources of healthy omega-3 and monounsaturated fats. Include more physical activity, ideally the American Cancer Society's goal of at least 150 minutes per week, but you can start, as one great brochure by the AICR says, start where you are, and make goals that make sense for you, including small amounts as best you're able, and work up toward getting yourself more active. Aiming for 8 to 10 servings of vegetables and fruits per day, and remember that rainbow and that spectrum of colors is important. And of course, making educated decisions when choosing supplements and evaluating the latest food trends, and always being sure to speak with a credentialed professional, a registered dietitian, preferably somebody who specializes in oncology, will have the great evidence-based information with which to help you make an appropriate decision, and of course your oncologist and medical team as well. So like I said, I thank you again for allowing me to be here today, and I look forward to some good questions, and I hope I've given you some information with which to make some good goals and make some good healthy choices for your summertime and for your overall survivorship. I wish you all the best.